Bismillahirrahmanirrahim. Today we will discuss about the easy way how to get a gynae history. I will share with you the template of the gynae history which can be used in your undergrad level as well as the postgrad level. So the foremost and the first most important thing of the gynae history includes the biodata. With relevance to the gynae history, it adds the few points which are linked to the gynae patient. The biodata includes name, husband name, married for, whether the first marriage of both partners or not, the age of the patient, number of children, last child born, the year, or how many years ago, the date of last menstrual period, LMP, education of the patient, to know how we can talk and deal with that patient, at which level, occupation of the patient, the residence, presenting complaint, and if the patient is already admitted in the ward and you are taking the history for your exam purpose or for completing your records, ask about the date of the admission and mode of admission. The mode of admission includes either from the outpatient department or through the emergency department. So let's begin with the history of presenting illness. In the history of presenting illness, these are the few points you need to cover in your history while taking from the patient, which includes the details of the presenting complaint. Anything, it can be anything, the pain, bleeding, mass, fibroid related to the gynecological problem, and then the details of each or in the following presenting complaint. And it includes duration, severity, associated factors, relieving factors, aggravating factors. So while completing your details of the presenting complaint, you should focus on the next part of the history of presenting illness, which includes investigations done so far. Ask the patient what investigations have done, what investigations have been pending, and then ask what treatment she has taken or what she has been treated in the ward or emergency up till now. And then ask about the patient's desire of that particular problem. For instance, if there is a mass in abdomen or fibroid uterus related to the gynae problem, you can ask the patient's desire what she wants. Either she wants a medical management, surgical management, conservative management, or anything else, interventional radiologist management. So you need to focus on the patient's desire as well. And then you move forward to the investigations and management part in the next station. So this is a very important step. You need to know about each of the patient while performing in the exam and as well as while fulfilling your records and history files. Then comes the gynae history. In the gynae history, first profile always asks about the age of menarche, regularity of the menstrual cycle, how long the cycle length, the number of the pads, so the amount of the bleeding, whether it's normal, average, less, or more. Then ask about the heavy menstrual bleeding, intermenstrual bleeding, IMB, and postcoital bleeding, PCB. Followed by this, ask the patient regarding dysmenorrhea, contraception details, what she has been used, why she has used that, the duration of the use of specific contraception and its side effects, which things she has obtained or sustained with these contraceptions, and if changed the method of contraception, why she has changed. Then ask about, more importantly, the pap smear test and the date of the last smear. This is a very important question related to the your gynecological history to rule out sexually transmitted diseases and cervical intraepithelial neoplasia (SIN). Then inquire the patient regarding the obstetric history and take the few points. Ask about number of children, their gender, the year, in which they were born, and the age of the children, whether they have been vaccinated fully or not, number of miscarriages or an ectopic pregnancy, the mode of delivery of that children or child, the discharge slip availability. You must ensure and you must focus on this. If the discharge slip is available, you need to ask about whether the patient has discharge slip or not. The complications in the pregnancy, labor, and puerperium in any of the pregnancy, and whether she has breastfed her children or not. Then talk about the past history. In the past history, you should quickly inquire through the medical history. Ask the patient whether she has any comorbidities like diabetes, hypertension, TB, tuberculosis, asthma, hepatitis, thyroid, or any other chronic illness which has led to the prolonged hospital admission or stay, and any prolonged history of drug intake. So just to inquire about the comorbidities. Regarding the past surgical history, ask about any surgery she has gone so far, the complications related to that surgery, the operation note available or not. Whenever there is any record of the hospital stay or any surgery in the past history, ask about the record available or not. This is the important point in your history. Then talk about the drug and the blood transfusion history. Quickly go through the any drugs. If the patient is unable to name that drugs, just simply politely ask her, show me those drugs or the color of the drug taken. More importantly, we usually in the local practice, we assume or we guess the name of the drugs by simply when the patient says that we have taken this red color, blue colored tablet in that particular time. For example, thyroxine is taken early in the morning, the one tablet white. The blue tablet for the diabetes includes the glucophage. The red and white capsule for the bleeding sustains that it is the transamin capsule. So these are the few of the examples by which you can guess if the patient is unable to name the drugs. Then ask her about any history of blood transfusion, its complication and reaction, if occurred. In the allergic history, ask any history of drug allergy, food allergy, or any other substance, for example, dust allergy or the pollen allergy. In the family history, quickly go through the comorbidities available, like I have mentioned, and diabetes, hypertension, TB, asthma, hepatitis, and others, and any other chronic illness, or most importantly, in the gynae, any history of family history of malignancy, and talk about any family history of malignancy like any family history of malignancy of breast or any reproductive organ in the family, especially in the first degree relative, and more importantly in the mother, sister, cousin, and grandmother. Then inquire about the personal history and quickly go through that. Ask about the sleep pattern, appetite pattern. Excuse the patient while asking about the history of smoking and other recreational drug abuse intake. This is important for the local exams like in the South Asian countries where these things are prohibited. However, while you are talking about the abroad exam or abroad culture, you do not need to choose the patient while asking that particular questions. Then ask about the socioeconomic history while asking about the patient, how many persons live in the home, how many rooms there in that home, do you live a stable lifestyle? This is the single most question while you can easily ask or inquire the patient regarding her lifestyle or socioeconomic history. Please rule out domestic violence. Is everything okay at home, or do you have a stable relation with your husband or family at home? Always and always rule out the domestic violence. With this ends the history template of the gynae. And let me show you the Urdu pattern of the gynae history template to make it easy for the people to ask in the Urdu, in the local language, especially in the South Asian countries. Ask the patient इन उर्दू, आपका नाम, आपके शौहर का नाम, शादी को कितना अरसा हुआ है, क्या आपको और आपके शौहर की पहली शादी है, आपकी उम्र कितनी है, आपके बच्चे कितने हैं, छोटे बच्चे की उम्र कितनी है या कब पैदा हुआ था, माहवारी की आखिरी तारीख क्या है, आपकी तालीम कितनी है, शोबा क्या है या आप कोई काम करती हैं और आपकी रिहाइश किधर है। फिर पूछिए प्रेजेंटिंग कंप्लेन का, किस मसले के तहत आई हैं। इफ एडमिटेड आज आप दाखिल कब हुई, दाखिल कैसे हुई, आउटडोर या इमरजेंसी से। देन गो थ्रू द हिस्ट्री ऑफ प्रेजेंटिंग इलनेस एंड डिटेल्स ऑफ दैट प्रेजेंटिंग कंप्लेन। आस्क द पेशेंट, उस मसले की तफसील के बारे में पूछिए, कब से ये मसले है। दीज आर द फ्यू बेसिक थिंग्स which you can inquire while talking about the past history. The history of presenting illness. पहले से ज्यादा मसला हो गया, बढ़ गया है मसला या कम हुआ है, क्या इसके साथ कोई और मसला है, किसी चीज के साथ ये कम या ज्यादा होता हो, क्या इसका क्या इलाज करवाया है अब तक, कौन से टेस्ट करवाए हैं, और मोर इम्पोर्टेंटली अब आप इस मसले के लिए क्या चाहती हैं। आइदर आप सर्जरी चाहती हैं, ऑपरेशन चाहती हैं, क्या आप चाहती हैं कि आपके अद्वियात से जारी रखा जाए या कुछ भी नहीं, या फिर कोई और तरीका इलाज। पेशेंट की विश के बारे में लाजमी पूछना है। देन इंक्वायर अबाउट द गायनी हिस्ट्री। माहवारी सबसे पहले कब शुरू हुई, क्या माहवारी ठीक आती है, दो माहवारी के दरमियान में खून पड़ना, माहवारी ज्यादा आना, माहवारी के साथ दर्द होना, शोहर से मिलने के बाद खून पड़ना, शोहर से मिलने के दौरान तकलीफ होना जैसे मसाइल। मनसूबाबंदी के लिए क्या इस्तेमाल करती हैं, बच्चेदानी के मुंह से शीशे वाला टेस्ट आखिरी मर्तबा कब करवाया, दिस इज द पैप स्मीयर। देन आस्क अबाउट द ऑब्स्टेट्रिक हिस्ट्री, कितने बच्चे हैं, बच्चे के जिन्स क्या है, लड़का या लड़की, क्या हिफाजती टीकों का कोर्स करवाया था, बच्चे को अपना दूध कितने अरसे के लिए पिलाया, पैदाइश नॉर्मल थी या ऑपरेशन, अगर ऑपरेशन है तो उसकी वजह और तफसील, और अगर नॉर्मल नहीं थी उसकी भी वजह और तफसील, या तो गोलियां रख के या दर्दे लगवा के डिलीवरी करवाई थी। कोई छुट्टी का कागज है तो दिखा दीजिए। हमल, डिलीवरी या उसके बाद में किसी पेचीदगी का सामना तो नहीं करना पड़ा। देन पास हिस्ट्री, शुगर, ब्लड प्रेशर, टीबी, जरकान, दमे का मसला तो नहीं है, लंबे अरसे के लिए बीमार रही या अस्पताल में दाखिल होना पड़ा, किसी किस्म की अद्वियात का इस्तेमाल करती हो। सर्जिकल हिस्ट्री में क्या कभी कोई ऑपरेशन हुआ है, क्या उसमें कोई पेचीदगी तो नहीं हुई, तो कागज है तो दिखाइए। देन द लास्ट फ्यू टॉपिक्स, द ड्रग एंड द ब्लड ट्रांसफ्यूजन हिस्ट्री, कौन सी अद्वियात इस्तेमाल करती हैं, अगर नाम नहीं याद तो मुझे दिखा दीजिए, या उनका रंग या दवाई लेने का टाइम बता दीजिए। कभी खून लगा हो, इसके दौरान में कोई मसला हुआ हो, किसी दवाई या चीज से एलर्जी हो, इन द एलर्जिक हिस्ट्री। फैमिली हिस्ट्री में खानदान में शुगर, ब्लड प्रेशर, टीबी, यरकान, दमा, कोई मूजी बीमारी, सरतान का मसला, सरतान इज कैंसर। Then ask about the personal history, क्या नींद ठीक आती है, भूख ठीक लगती है। माजरत के साथ कुछ जाती नौयत के सवाल पूछने हैं, सिगरेट नोशी, पान या कोई और नशा वगैरह तो नहीं करती। इन द सोशल इकोनॉमिक हिस्ट्री आपने पूछना है घर में कितने लोग हैं, कितने कमरे हैं, आमदन के जराए क्या हैं, क्या गुजारा ठीक हो जाता है। दिस इज द सिंगल मोस्ट क्वेश्चन यू कैन इजीली आस्क टू जज द सोशो इकोनॉमिक स्टेबिलिटी ऑफ द पेशेंट। क्या घर में सब ठीक है, क्या आपके आपके घर वालों के साथ ताल्लुकात ठीक है, to rule out the domestic abuse. This is the end of the gynae history template. I hope it is the easiest way to get the history, and I have told you the each and every details of that. Thank you and good luck.